avoidance, restricted interests, speech and language disorders, tantrums, and meltdowns, just to name a few. Fortunately, there are solutions. Just about all of the children with autism have underlying medical conditions that the child is reacting to. Digestive issues like constipation, diarrhea, and acid reflux affect up to 84% of children with autism, and up to 80% suffer from sleep disorders. These children typically can't say what hurts, so they wind up acting out. When their medical conditions are diagnosed and treated, it's like they're a different child. Now, I want to be clear, I'm a big supporter of behavioral, speech, and occupational therapy. And there are also programs that address specific problems that autistic children have, like chewing and swallowing properly and responding to external stimuli such as loud noises or bright lights. I want to be clear, all of these methods are important and helpful. At the same time, after dedicating my life to treating autism since I was 10-years old with a brother on the spectrum, what I found is that there is actually one key that unlocks successful treatment. There is one approach that is foundational that the others can rest on that makes all of them more effective. And that one vital thing is the child's medical condition. This is really because there are underlying medical issues that are causing a lot of these behaviors. So if you're just trying to address it with just treating behaviors and trying to modify the child's behavior, long term, it's not addressing the root cause of what is going on. There are answers, and children can get better. Diagnosing and treating the medical conditions, the body's physical imbalances that can give rise to autistic behaviors can make a world of difference. There are 4 major areas of the body that are commonly affected in autism, areas where medical problems typically manifest. By treating these underlying conditions, children are able to improve over time, sometimes dramatically. So, what are these 4 areas? The first is the neurological system, which includes the brain and the nerves, not surprisingly. The second area is the digestive system, which includes the throat, esophagus, stomach, small and large intestines. The third area is the immune system, which includes the lymph nodes, tonsils, spleen, white blood cells, and bone marrow. And the fourth area is the metabolic system, which includes the liver, thyroid, adrenal glands, and the mitochondria, which power most of the cells in our body. With the neurological system and the brain, there are several medical conditions that we commonly see: brain inflammation, seizures, and antibodies that are attacking the brain. One of the antibodies is called folate receptor antibody that blocks folate from getting into the brain. Folate, or vitamin B9, is critical for normal brain development and brain function. This is 75% of children with autism. These neurological conditions can affect a child's language, awareness, learning ability, coordination, behavior, sensory processing, such as with taste, loud noises, and strong light, and sleep patterns. The good news is that all of these conditions are treatable. For example, with seizures, which are uncontrolled electrical activity between brain cells, I've treated some children who had aggressive and or self-injurious behavior, like banging their head on the wall. Other young patients had periods where they're not responsive, where they're staring off into space. While most people don't typically think of these types of behavior as the result of seizures, a child doesn't have to be shaking on the ground to be affected by them. In fact, another sign of seizures is forgetfulness. Once seizures are treated medically with upgrades to diet and specialized supplements, vitamins, herbs, or medications, the associated behaviors improve, sometimes dramatically. With the digestive system, we can see aggressive or self-injurious behavior, meltdowns, or crying coming out of nowhere. Often the child suffers from constipation, which can magnify the intensity of their behaviors. They might also have inflammation in their intestines, or stomach or acid reflux. In addition, there can be bacteria and parasites as well as food allergies or sensitivities. I've treated children with some or all of these digestive conditions, and when they're treated medically, their behavior often improves dramatically. Also, some of my child patients have had food allergies or sensitivities, and when we removed the foods that were causing them, their language improved, or problems like meltdowns diminished or went away completely. Now, when it comes to the best treatment, it's important to emphasize that everyone has a different makeup, so each person needs individually tailored medical solutions. Call our office to schedule a no-charge medical consultation with me so that I can talk with you personally about your health concerns. Phone and other contact information is on our Facebook page. If you want to purchase the vitamins and minerals I'm discussing, please visit our supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. There is a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. A link is in